be aware of their bodies and want to take care of themselves. And 30% of women do have varicose veins.
So 40% of the population?
30% of women and 10% of men.
Okay.
Yeah. So is that 40% of the population? I guess it is. It's extremely prevalent, extremely common. Other things that go along with varicose veins, if you have a standing occupation, like if you work at Amphenol or Mead, we take care of a lot of patients from there. And that's actually been shown in all kinds of studies.
You can get varicose veins by being on your feet all day?
Exactly. Because what happens is when you're not walking and you're not squeezing that calf muscle to make the blood flow up towards the heart and it's just sitting there, those veins start to swell, they start to swell, they start to swell, and then they can start to fail.
Right.
Yeah.
So good shoes, none of that, that's probably not going to help out in that situation.
No, taking a walk around your workstation, getting up on your toes, having a little footrest to put your feet up on, and wearing compression hose can help as well.
Right. Now, is varicose veins hereditary?
It's extremely hereditary. If you have one parent who has varicose veins, your risk is 50%. That's 1 in 2. If both of your parents have varicose veins, then your risk is 90%.
Wow.
Yeah.
So if it runs in the family, you might start. Now, say it does run in the family. There's a girl or guy out there watching, knows for a fact, when should they start getting checkups with you? Because I'm thinking the earlier you get it, it's detected and diagnosed, the easier the treatment.
Right. If you have any of those symptoms that we talked about, pain, aching, swelling, your legs are real swollen at the end of the day, or just a little bit of swelling and they're really achy when you're on them, and they get better, feel better when you put them up, or if you're having some thickening of the skin, if you're having some rashes on the skin that won't go away, some itching of the skin, or if you're developing cramps in your legs, then I would get them checked.
Wow. All right, the number to call, 607-433-8815, 607-433-TV15. That'll get you through if you have a question about varicose veins. Dr. Dohner is with us this evening from Oneonta Laserderm. Now, what about weight?
Well, this is very interesting.
Play a role.
Yeah, this is very interesting. And we see a lot of people who have varicose veins who are overweight or obese. But population studies have not shown that obesity causes varicose veins. And this was a question on the board certification a couple of years ago, and I'm sure it tripped up some of the physicians, but we do know that weight does not cause varicose veins, at least in the studies that we currently have.
So heredity, if your parents have it, you're probably going to get it, 1 in 2 chance, both of them 90%.
Right.
But weight does not. Very interesting. So they need to make an appointment to come on in and see you because, you know, to someone who's not trained, like the doctor was saying, it can look like eczema or a bruise or
psoriasis,
diabetes and psoriasis.
Spider veins.
Exactly. So, so those are some of the causes. And is varicose veins, is it an actual disease?
Is it a disease? Yeah, you can think of it as a disease. We have a whole field of study in medicine called phlebology, which is dedicated to the diagnosis and treatment and study of varicose veins. So there is venous disease. There's a genetic component to it that causes abnormal protein deposition. We know it's associated with heredity. We know that women get it more. So is it a disease state? Sure it is.
It's an actual disease. So the signs are there for it to be an actual disease. You're got a lot of extra training, and you're the only person locally that can really take care of this, correct?
Correct. I'm the only one who is board certified by the American Board of Phlebology in the area. Of course, there are vascular surgeons in the area. I'm the only one in probably an 80-mile radius who's offering endovenous laser ablation.
Now, you're constantly getting more training in this area. You do a lot of traveling. You're doing more training. Where does that take you? Where do you have to go and get more training?
Well, we have our national meetings at least once a year. I'm going to the International Vein Conference in Miami in May. The American College of Phlebology has an annual meeting in Phoenix in November. So you know, it's very important to stay on top, because what we're doing is learning tidbits all the time to make the experience better, to have patients get back to work sooner, to have less risk of complications.
Are there people out there, for example, the American Cancer Society, you know, getting money, looking for new cures for cancer or a cure for cancer and so on? Are there teams of people constantly doing research on varicose veins, looking for better treatments, more effective treatments, and like you had just said, a quicker recovery time?
Yeah, there are. There's a couple of foundations, the American Foundation of Phlebiology, which is dedicated towards funding research towards this. There's another big organization called the American Venous Forum, which is involved in all forms of varicose veins and vein disease and blood clotting. The American Venous Forum is now supporting the Surgeon General's call towards a greater awareness of varicose veins, vein disease, and blood clotting, and there's a big push going on right now specifically for that.
Are there any new treatments that you're excited about, or that sounds really promising that you want to learn more about to bring to Oneonta?
The interesting thing is that the type of lasers that are available are always changing, and what happens when you change the wavelength of a laser, it interacts differently with the wall of the vein, and depending on how it interacts, it can cause less potential complications just in terms of postoperative pain. We changed our laser about a year ago, and it's too technical to get into in terms of the wavelength and everything.
Okay.
The laser itself costs $105,000, but what it does is people are having significantly less pain compared to the previous laser. And now most people, in terms of postoperative pain, say, you know, I took a Tylenol or two for a day, and I decided I didn't need any more. And so they're not in need of any kind of postoperative medication most of the time.